Here with me now in the studio is Dr. Kate Tulenko. She is the CEO of global health firm Corvus Health. We just saw in the story this cryosurgery. You've heard of cryotherapy, athletes using it, but what do you make of these technologies and the impact they're having on treatments and survival rates? Are they really making an impact here?
Yes, these treatments are indeed making an impact, particularly cryotherapy, because as the doctor explained, it's minimally invasive. People recover faster. It can be done on very advanced disease, including tumors that couldn't be operated on in a regular surgery. And plus, I think people might ask, why is this hospital specializing in this, and why are people coming from around the world? And there are a number of different reasons for that. One is that China every year has 4 million new cancer patients, and so that's sort of an economy of scale that makes it possible to purchase the equipment, to train the staff, and offer the services. In a smaller country where maybe you only have a couple thousand cancer patients a year, it doesn't make economic sense to offer these therapies. Another reason also is often in China, people are diagnosed with more advanced cancers and they need these therapies. People who are diagnosed very early can often be treated with traditional surgery or traditional chemotherapy, but advanced cancers need these more advanced technologies. And another reason is the regulatory environment in China. You can put a positive spin on this and say the regulatory environment, especially with the Made in China 2025 plan, is conducive for rapid uptake of innovations. You could put a negative spin on it and say that the regulatory environment in China doesn't necessarily protect patients from therapies that may not be tested.
But it seems to be working.
Yeah, yes, the cryotherapy does. Yeah, absolutely.
This is something that I just heard about, but has it been around for a while, or is this something that's still sort of on the newer edge of cancer treatment?
Well, in the West, it has been around for a few years, but we're seeing increasingly rapid uptake in China. It used to be maybe it took 10, 15 years for technologies to transfer. Now we're seeing 2 or 3 years, and I think we can expect that cycle to shorten as well.
What are you seeing globally as far as the progress we're making when it comes to cancer cures? Are we getting there? And we're hearing about these new technologies. Are you seeing new trends or things to try every day?
Yes, the most promising is the immunotherapy. So one of the reasons that cancer is able to grow and survive is it tricks our immune system into thinking it's not foreign and it shouldn't be attacked. And so scientists are coming up with new ways to either boost the human immune system or to block the cancer defenses. And so these would include things like cancer vaccines, where you would inject a patient with proteins that are very common on the cancer so that their immune system can learn about these proteins and then attack the cancer. Or you can inject them with monoclonal antibodies, which are man-made antibodies to attack the cancer. There are other drugs which can rev up the immune system, so the immune system in general will be more active, and still other forms of immunotherapy where you take the immune cells of the patient, genetically modify them to be sort of super immune cells, and then re-inject them back in the patient.
Overall, are you optimistic about what you're seeing, and are you surprised by the number of people who are willing to travel to get help?
I am optimistic, and certainly not surprised, because with cancer, if you failed all the other treatments, you know most likely you're going to pass away. So people knowing that will go to almost any lengths to seek treatment. But another important message we need to get here is it's still very important to prevent cancer. So people need to consume less tobacco, less alcohol, meat, maintain a healthy weight, exercise, and also the issue of early diagnosis as well, especially cancers for which there are good screening programs like breast, cervical, prostate, and colon cancer.
Dr. Kate Tulenko, always great to hear your take and great advice. Good reminder at the end. Thank you.